Hello, everyone. Welcome to another episode of the Anti Pharmacist Podcast. It's a brand new week, and I want to wish you all the good things you wish yourself this week. I pray that this day sets a good tone for your week. On today's episode of the Anti Pharmacist Podcast, I'll be discussing a topic that has to do with people treating chronic diseases. Okay, a lot of problems are encountered by this group of people, not just because of the disease itself, but because of the management of it. A lot of people are number one shocked by their diagnosis, right? And they kind of cannot accept the fact that they have to use medications for a long period. So this affects the way they manage this medication. Some people in their head, they have even checked out, like they are not willing to cooperate with their healthcare provider to actually treat these illnesses. I know that chronic diseases can be challenging and it occurs majorly, most especially in the adult population, probably because of aging, amongst other things. And there are younger people too that have some chronic diseases. So living with it in their day to day life is something that they do not want to think about. So taking medications for it, sometimes they believe that it's an azu. Like some people just live in denial, basically. And this affects the progression of this disease. Some diseases, of course, they're chronic, but they can still be controlled up to the point that they may even be non existent in quote after a while. That is if you use your medication properly. But because of that chronicity of it, when the healthcare provider tells them that you have to take medications for this condition for longer than a month, they just check out mentally, like, no, I'm not ready. And because of this disease continues to worsen and can even cause other diseases when in fact it could have been managed effectively. So, which brings me to the topic of today, which is proper medicines use in chronic diseases. I know I've talked a lot about proper medications use on this podcast, but I believe that I should zoom in the lens a bit more because of this category of people. Okay. And I've explained why just a few minutes ago. Without further ado, let's get right into it. So, what are chronic diseases? According to Center for Disease Control and Prevention, which is a body that has to do with diseases and their control worldwide, a chronic disease is a condition that lasts a year or more and necessitates ongoing medical attention. It could also limit daily activity. Okay. According to statistics, approximately 1 in 3 adults worldwide suffers from multiple chronic conditions. Like I said earlier, aging is a factor in the development of chronic diseases. But it doesn't only affect adults, it affects children too. There are some genetic conditions that people are born with and they have to manage with medications all their lives. There are diseases that are not due to age. They could be infections that will last a long time and that would require treatment for a lifetime. For example, HIV and AIDS, hepatitis B, and there are some that they require treatment for months, ranging from maybe 6 to 9 months, like tuberculosis, for example. There are many examples of chronic diseases, but let me just mention a few. Okay, for some that are not even aware that what they have is a chronic disease. Examples are asthma, chronic obstructive pulmonary disease, cardiovascular diseases like congestive heart failure, angina, hypertension, stroke. There's arthritis. There are thyroid diseases like hyperthyroidism. There's diabetes, chronic hepatic disorders, chronic kidney disorders, hyperlipidemia, sickle cell disease. There are gastrointestinal diseases like your inflammatory bowel disease. Of course, there is cancer. Cancers in any form are chronic diseases. Now, not to talk of Alzheimer's disease, Parkinson's disease, epilepsy, anxiety disorders, psychosis, or schizophrenia. All of these are chronic diseases. Of course, there are more, but these are just the common ones, okay? If what you have is a chronic disease, I'm sure that you'll be told during your diagnosis by your healthcare provider. And these diseases, like I said, they could lead to complications if proper treatment is not done, okay? So I interact with a lot of patients, and when they come in and maybe they check their blood pressure, and after multiple checks, of course, they have been diagnosed with high blood pressure, and you try to, give them medication as prescribed by their doctor, or you recommend some to them, the next thing they ask is, how long will I take this medication for? And you're like, there's no particular time. You just have to keep taking it. That minute they hear that, they're like, "Ah, no, I would like to take medication indefinitely. I can't do that." From that moment, they have decided to not adhere. And you can't continue to list to them the kind of consequences that comes with non-adherence. It could be tantamount to you scaring them that, if you don't take this your medication for your diabetes or for your high cholesterol for as long as I tell you, you might come down with retinopathy, your kidney may shut down, your liver may shut down. That could scare them and even, chase them away completely. You have to find a way to make them understand that these medications are actually there to help you. They are not a burden, which is why I'm doing this. Okay. So if you know anybody who has a chronic disease, please share this with them so that they can understand better the proper way to use their medicines, or the reason why proper medicines used in chronic diseases is important. Okay. Now that I've defined chronic diseases, I've given you examples as well, right? There are medications that are required, to treat all these kinds of diseases. Now, like I said earlier, there are problems encountered with treatment of chronic diseases. Number one is non adherence. They don't want to adhere. Like, it can get tiring having to use medication every day of your life and not knowing when you will stop using it. It can be kind of discouraging, okay? That is one. Another one is the problem of side effect or adverse drug reactions. I'm glad that I've talked about side effect and adverse drug reactions in recent episodes. Okay, you could listen to those and just take the information you need from there. Then the third problem is polypharmacy. That is using many medications at once, especially for people who have multiple chronic diseases. Okay, you can use up to three, four, five medications at once, or even more. There are people like that they have comorbidities, lots of them, and they have to use many medications. Polypharmacy becomes an issue because the higher the number of medications, the higher your risk of getting side effects or adverse drug reactions, the higher the probability of drug interaction, drug food, and all of that. So it's a problem for those that treat chronic diseases in most cases. And a very important one, especially in this economy, is the financial burden of it, having to buy medicines week in, week out, month in, month out. These are the problems encountered with medicines used in chronic diseases. And I'll be profiling the solutions that I think will be of help to you and will help you use your medications better and manage your diseases better. Okay. Number one solution, we are addressing the number one problem, which is the non adherence, is abandon it. That mindset that I can't continue taking medication for the rest of my life. Just carpe diem, seize the moment. Just focus on the day alone. Do not think too far into the future. Okay? Face that problem head on with the mindset that you are going to win this. Okay? Don't think of the future that, I'm only 25. So I'll take this now for the rest of my life. I'm only 50. I still have my life ahead of me. Don't think of that. Just think of taking care of that problem at that moment. Okay. That will help with your adherence. Another thing common to people that use medications for chronic illnesses is they skip their doses, missed doses. And luckily, I've addressed that on this podcast as well, just a few episodes back. So, aren't you lucky to have this podcast? Really, go listen to that. I've also talked a while back about using pill organizers. That is on proper use of your medications. Please go and listen to all of that. This podcast is there to help you throughout your journey of medications use. And not only that, in even your health generally. So, what are you waiting for? Make Anti-Pharmacist Podcast your staple, okay? Subscribe to it. You get notification each time I drop a new episode, and you can listen at your convenience. Okay, let me not digress. Work hand in hand with your healthcare providers. If there's anything you're not clear about, if there's any doubt you're having, talk to them. That's why they're there. Your pharmacist is always there for you. Community pharmacists are everywhere. Choose a trusted pharmacist that you can relate with. We are there to listen to you. We are at your service, okay? Confidentiality is guaranteed. It's part of the ethics of the profession. Talk to your doctor, okay? Monitor your vital signs from time to time. You're treating high blood pressure, for example. Do not joke with checking your blood pressure, even when you're taking your medication. Check it. Know how your drug is working. Oh, if there's already tolerance developing or you're already sleeping in your lifestyle modifications, that would be a kind of alarm for you to let you know that, oh, this drug is not working for me anymore. Then you can see your healthcare provider and talk to them again. This helps with your adherence. You're somebody that takes an anti-diabetic medication. Check your blood glucose level always. I remember that I had one old man patient. He was like my model patient, always coming in to check his blood pressure and blood glucose level. And he was doing fine on his medications because he was conscious of that condition and was ready to fight it. So having that fighter mentality is very important, that this disease, it is me and you. It's a battle and it's survival of the fittest. Do you understand? There was this other patient, okay? He just walked in randomly into the pharmacy to check his blood pressure and it was extremely high. Okay, I checked it more than once, of course, after he had rested very well, and it was still very high. I informed this patient, and the next thing he just took off and left. He just went out of the pharmacy. Like, what's up? Why? He just stood up and was leaving. I had to go after him and call him back that, sir, you can't just hear something like this and leave. This is the attitude of most people. When you hear about your chronic illness, the first thing that comes to your mind is flight. Let me just go. I don't want to hear any more of this. This is bad news. Well, I called him back, counseled him, told him about lifestyle modifications, then recommended some medications. Okay, and he accepted, partnered with me, and he kept using the medication, coming back for his checkup. Of course, I advised him to go see a doctor in the hospital. In a matter of weeks, the blood pressure had greatly improved. At least the danger for that period is over. Who knows, if he had just left the pharmacy like that, he could have had a heart attack on his way going home, all because he did not calm down, to seek the next step forward. A lot of patients are like that. Please don't be like that. Once you hear your diagnosis, ask what is the next step to take. And when you're giving your medication, endeavor to use it judiciously. It's all for your own good, okay? And cooperate with your healthcare provider. Don't think that, oh, they shall want me to be using medication for the rest of my life. No, I will just use it for 2 days. I will leave it for the other days. I will just go to prayer mountain. Prayer is very important. But all these medications also, they are there to help you. Prayer and using your medications are not mutually exclusive. I know we are religious people, especially in this part of the world, but that doesn't negate you doing what you are supposed to do. Using your medications and praying, none should stop the other. Do you understand? So work with your healthcare provider. That is about non-adherence as well as side effects. Okay, because you use this medication, didn't like how it made you feel. You now stopped. I've addressed that in the just concluded episode. Okay, this last episode, previous one, please go and listen to it. Talk to your healthcare provider. If you have to change your medication, they'll help you change it. If they have to give you something to counter that side effect, they will. And if they have to reduce the dosage of that medication to reduce the probability of you having the side effect or adverse effect, it will be done. Apart from adverse drug reaction, something called tolerance sets in, that after you have used medication for a long time, the body can get used to that dose and the effect reduces, the effect diminishes over time. Okay, there are solutions to these things as long as you're willing and ready to cooperate with your healthcare provider. Do not leave them alone. Do not take a medication now. Buy 3 months worth and just go home. Not looking back, not going for your checkups, not talking to your doctor. Just say, I have the money, I've saved some money up. Let me buy 3 months worth of my medication. You just go home like that. No. Be in communication with them from time to time. Let them see the progression of your illness. Let them see how this drug is working, how it is helping you. You are using anti-cholesterol medication. Always have your lipid profile test done. Okay, you are treating hepatitis. Always do your liver function test. Do not go for a long time just using medications. It's only when you monitor from time to time that your healthcare provider can notice this and say, oh, I think you need a higher dose of this medication. Oh, this adverse effect seems to be coming up. Let's reduce the dosage and substitute with something else. Do you understand? So, monitoring your condition, being in constant touch with your healthcare provider, they are things that you have to do. They are non negotiables, okay? The third problem is polypharmacy, like I mentioned. And how can you deal with polypharmacy? I've defined it taking more than 5 medications at once, or even just combining medications generally. There is risk of increased adverse effect, there's risk of drug interactions. Just like I've been saying, there are drugs you should not use together. At the end of the day, what you still have to do is work with your healthcare provider at every point in time. It's only when you are in constant touch with your healthcare provider that it can help you manage your medication therapy effectively. Oh, these 2 medications, you can take them at the same time. Leave like an hour or two in between before you take this two. They schedule with you, they plan with you, just so that you manage the condition well. And who knows, if you manage well enough, the number of medications you might have to take over time may even reduce. There are cases in which, from taking daily doses of medications, maybe for hypertension or diabetes, patients have been told by their healthcare provider to now do alternate days, sometimes even 2 days interval. Do you understand? It depends on you willing first and adhering to medications, monitoring your parameters. That is the first step. And from there, you may think you have to take this medication for the rest of your life. And you may be surprised that you won't have to only if you do the right thing. Okay? Another problem I noticed with managing chronic diseases in patients is that maybe because some of them move around, maybe due to traveling or work, some forget their medications at home, okay? And when they get to their destination, getting that exact medication they use may be a problem. So they may see a healthcare provider, maybe a pharmacist, who gives them a different brand of the same medication. On getting back to their station, they mix these medications together, and this may result to misidentification of medications. Some can then take overdose using the same medication but different brands. I hope you understand this example I'm giving. So in this case, your pharmacist is there to help you with your medication therapy management. If you have so many brands of medications in your medicines box that you cannot even identify which is which, please take them to your pharmacist. They will help you separate them. I've done that for a lot of patients, really, with good outcomes. Instead of just taking medicines and say, I don't even know which is which, let me just take any. Please carry your medicine box. Don't let it be a hassle for you. Take them to your pharmacist. They will separate the same medicines but that are different brands for you. Tell you how to use them to still benefit from them. You may not have to throw all the different brands away, but there might be a systematic way in which you can use them all to get benefit from them without you wasting your money. Okay? I know that I've said it on this podcast that you don't have to insist on a particular brand all the time because it may not always be available. Do you understand? But there are ways around it that you can use different brands of the same medicine and still get optimal outcome from it. Let your pharmacist help you. That is why we are here, to help you manage your medication therapy so that you can get the best benefit from them. And lastly, the financial burden. I know it can be a lot. Countries are going through economic recession. People are going through a lot when it comes to finances. The Nigerian situation is even nothing to write home about right now. But these are things that you need. It's just like your food at this point. You have to plan for them, just like you plan for your basic needs. You have to plan for your medications as well. Don't say, I don't have money, so I cannot buy it. You know that that's at the detriment of your health. You have to plan for them. Okay, this is where you can seek support from friends and family, close ones. Let them know your plight, how you need medications to treat your illness, and how much they cost. Okay, they can be of help. I know that it can be a dicey situation, but try your best. And again, you can plan for your medications budget. like I said, you could decide to buy 3 months worth when you are financially buoyant. Of course, making sure that the expiry dates are in order. Keep them in the house, be taking them from time to time so that you are not affected by inflation. You can do bulk buying of your medications. You can buy them in bits depending on your purse. You can opt for generics instead of branded medications as long as they're authentic ones and you get them from the right sources. You can also take advantage of health insurance. Okay, there are many insurance agencies. How you can access health insurance to help you reduce financial burdens on your medications. Even you can have some credit facilities if you are credit worthy in some places, okay? And you get your medications. I've talked about that too on this podcast. So please, what do you need again? Pharmacist is here for you for everything you need concerning your drug information. What are you waiting for? You better subscribe now. So there are ways around these things, okay? You could even get financial aids when it gets down to it. Thank God the internet is all over the place now. Things have become easier. You can seek help from well-meaning individuals. I remember that there was this client that did a drive for students with asthma. He came and bought inhalers in bulk and gave them out freely to these people. So there are individuals like that. Look out for things like that. There are benefits that you could lay your hands on, you could get from being aware of certain things. Do you understand? Talk to people. Then I know taking medications for chronic illnesses can have a psychological toll on an individual. If you know that it's affecting you the way you think, it's affecting your mood, your work, talk to a psychologist, talk to people, seek help. Even your healthcare provider, your pharmacist, your doctor, we are also there to encourage you, to help you. Talk to us. You understand? So these are ways to use your medications properly. These are ways to manage your chronic illnesses properly so that you get the optimal therapy, so that you benefit. Okay, those are the problems I have discovered from my years of experience in helping patients manage their chronic diseases, and the solutions that I can think of to prefer to you. Okay, if there are other problems that I've not talked about or solutions that you think can be beneficial, please do not hesitate to leave them in the comment section. And that is exactly what I want to talk to you about today. Proper medicines used in chronic diseases, or you could call it management, proper management of chronic diseases. Okay, please do leave your thoughts once again in comment section. Follow us on socials, on IG at Antipharmacist Podcast, on X at Fan Podcaster, on LinkedIn, Bemisola Adebisi Joseph, on Facebook, Bemisola Adebisi Joseph. As soon as we get on other digital platforms, I will let you guys know. But know that I'm working tirelessly to make sure that this health information reaches everywhere. And you can help me as well by following this podcast, subscribing to it, leaving your comments and reviews, giving your suggestions, reaching out to me for collaboration on my Gmail at antipharmacistpodcast@gmail.com, and sharing with people. Share. It helps this podcast to reach as many people as possible, and it just helps it grow and helps the general populace. Okay, thank you so much for listening up to this point. I wish you a wonderful week. See you on Friday. Till then, stay healthy and God bless you.